Dear students, April 17 is celebrated as World Hemophilia Day. Today we shall be talking about the World Hemophilia Day. But before, it is my request to you all to press the bell icon and subscribe my channel BioLearnia. First of all, we shall be talking about what hemophilia is. Hemophilia is derived from the Greek word which means blood, and philia which means loving. So blood loving is the meaning of the hemophilia. Hemophilia is a rare inherited disease where a person is lacking a certain type of clotting factor. This means that their blood is unable to clot, so the injuries will result in extensive bleeding. So if left untreated, this bleeding can become life-threatening. So it is profuse bleeding without the formation of the clotting factor or without the presence of the clotting factors. So it is the lack of the clotting factors which makes the person to bleed and even bleed to death. This year, that is 2021, the logo of the World Hemophilia Day is on your screen, and its theme is adapting to change, sustaining care in a world. So the theme of 2021 World Hemophilia Day is adapting to change, sustaining care in a world, and it is the April 17 which is celebrated as the World Hemophilia Day. World Hemophilia Day is an international awareness day for hemophilia and other bleeding disorders. It is held annually on April 17. It is the date of the birthday of Frank Schnabel, the founder of the World Federation of Hemophilia. Since 1989, World Hemophilia Day is the day the whole bleeding disorder community comes together to celebrate the continuous advances in treatment while raising awareness and bringing understanding and attention to the issues related to the proper care to the wider public. So when we talk about the hemophilia, we see that many times what happens in the case of the healthy, you can say healthy persons, that they have the normal blood vessels, and if there is some kind of the hemorrhage, the clotting occurs in the case of the healthy ones. But in the case of the hemophilia, if the hemorrhage occurs, there is inability to clot, and thus there is the profuse bleeding. Now, we shall be talking a little bit about the World Federation of the Hemophilia. What is this World Federation of the Hemophilia, which is a humanitarian aid program which celebrates the World Hemophilia Day? This very World Federation of the Hemophilia, it is an international non-profit organization which was established in 1963. So this WFH was established in 1963, and it is a global network of the patient organizations in about 140 countries and has official recognition from the World Health Organization. For over 50 years, this very WFH, that is the World Federation of the Hemophilia, has provided global leadership. This for over 50 years, this very WFH has provided global leadership to improve and sustain care for the people with inherited bleeding disorders, and including hemophilia. Then von Willebrand disease, which is rare factor deficiencies and inherited platelet disorders. This is all which this very World Federation of the Hemophilia takes care about. Now, what is the vision and the mission of this very World Federation of the Hemophilia? It believes that every person with an inherited bleeding disorder deserves access to care and treatment. And its vision of treatment for all, that is, no one should be worried about this very hemophilia or any other bleeding disorder. They should be treated they all should be treated, and one day all people with the bleeding disorder will have proper care no matter where they live. The mission of the WFSH and the WFH is to improve and sustain care for the people with inherited bleeding disorders around the world. Hemophilia, when we talk about the hemophilia, it is usually an inherited bleeding disorder in which blood does not clot properly. So this can lead to spontaneous bleeding from even slight injury as well as bleeding following injuries or surgery. It is typically caused by hereditary lack of the coagulation factor, that is factor 8. Now, the most common symptoms of the hemophilia, they are bleeding into joints, prolonged bleeding from the cuts or injuries, nosebleeds, and bruising. Hemophilia can result in the bleeding within the joints that can lead to chronic joint disease and pain, bleeding in head and sometimes in the brain, which can cause long-term problems such as seizures and paralysis. Death can occur if the bleeding cannot be stopped or if it occurs in the vital organs such as brain. There are different types of the hemophilia, mostly categorized into four, but mainly two are the main types of the hemophilia. Now, let us know some different types of the hemophilia. Hemophilia A, we call it as the classic hemophilia, and it is caused by the lack of the decrease of the clotting factor 8. So when the clotting factor 8 is deficient, the hemophilia A is caused, and it is X-linked recessive disorder. And hemophilia B, we call it as the Christmas disease. It is because of the lack or decrease of the clotting factor 9. It is X-linked recessive, you can say, disorder. Then we have two other hemophilia as well. One we call it as the hemophilia C, which is caused by the lack or the decrease of the clotting factor 11. It is also autosomal recessive disease. Then we do have the parahemophilia. It is caused by the lack of the clotting factor 5. It is also a autosomal recessive disease. Let us have a little bit knowledge about some of the facts about the hemophilia. There are three different types of the hemophilia, that is A, B and C, but sometimes parahemophilia is also counted as the hemophilia. The type is determined by the clotting factor the person is deficient in. So it is based on the type of the factor. If it is factor 8, it is hemophilia A. If it is factor 9, it is hemophilia B. If it is factor 11, which is lacking, it is hemophilia C. And if this very factor 5 is deficient, we call it as the parahemophilia. So more deficient in the clotting factor a person is, the more severe their hemophilia will be. So there is no cure for the hemophilia, but with preventive treatment people can live normal healthy lives. The clotting factor involved are 8 for A and 9 for B, and as I was telling you about 11 for C and for 5 for the parahemophilia. People living with hemophilia A and B need to have the clotting factor this 4 for every couple of the days. Then we do have the hemophilia C, which is considered less serious than A and B, and the bleeding tends to occur following the surgical or the dental procedures. People with hemophilia C do not need regular clotting factors. Hemophilia A and B, they are carried on the X chromosome, so affects boys more than that of the girls, but females can be carriers of the disease in the case of hemophilia A and B. So hemophilia A is most common type of the disease. It affects 1 in 5,000 boys, and hemophilia B affects 1 in 25,000 boys, and hemophilia C just 1 in 1 lakh you can say persons. It is estimated that there are around 20,000 people in US with this very condition, and around 50,000 are also recorded in India as well. but most of the times the cases go unrecorded. Hemophilia C affects males and females equally, and the disease is usually detected early in the life, with severe cases usually diagnosed within a month and the mild cases within the infant in about 18 months. So complications from the hemophilia, they include joint pain, arthritis, heart diseases, kidney diseases, and hemophilia and kidney disease and hemorrhaging. So particularly the cranial hemorrhaging. So these are the serious repercussions of the hemophilia. But World Federation of the Hemophilia, they have the vision that the persons with the bleeding disorders, they should lead a respectable life, so there should be the treatment for all. That is why, to make awareness among the people, this World Hemophilia Day is celebrated. Thank you. This was all about this very World Hemophilia Day. Thank you very much. It is my request to you all to like and subscribe my channel, BioLearnia. Thank you.